Hello, everyone, and welcome back to Resilient Health Radio. I'm your host, Dr. Darren Ingalls. And I think one of the most important things that happens with any kind of chronic illness is this element of inflammation. And you can trace pretty much anything from neurological disease to heart disease to diabetes, obesity to some element of inflammation. So you guys are going to love my guest today. Dr. Elena Villanueva is one of the most engaging leaders in functional medicine. I've known her now for several years, and she's an expert on inflammation, mastering trauma, really two of the toughest underlying and often hidden causes of chronic illness. So you guys are definitely going to stick around for today's talk. So Dr. Elena, thank you so much for joining me today.
Thank you so much for having me, Darren. I'm really glad to be here and talk about such a relevant topic.
So maybe we just start out talking a little bit about inflammation. This is a natural process, right? We want inflammation to a certain degree because this is part of how the body heals. But we'll talk maybe a little bit about when does inflammation go awry?
Inflammation, you're right. It's a necessary part of the healing process. In fact, you know, uh, inflammation to a degree, whatever, certain types of it can even be considered a type of like hormesis. Like it's actually really good for you and can actually slow the aging process down and different things like that. But when it becomes a problem is when it becomes out of control, when it's not being used for its original intention of the healing process. So when you have it chronically, when it's all the time being caused from something outside of the normal healing process.
Yeah. So, I think what a lot of it, we've all had the experience of inflammation, right? We jammed our toe, we hit our hand or whatever, and, we get the typical, pain or maybe sometimes some redness and swelling. Are there other, symptoms of inflammation that people really may not be aware of?
Oh, absolutely. One of the biggest ones that people are not aware of is weight gain. A lot of people will hold on to weight for years thinking that it was fat weight, when in fact it was inflammation. And a really good example of this, we see this consistently with practically all of our case studies that we do. And we do case studies on every single client that we have. They will lose between 15 and sometimes upwards of 28, 30 pounds in a month in their first month of working with us. And it has nothing to do with really fat loss. It's a loss of inflammation. And people are amazed. They're like, I can't believe how much weight I've lost in a month. I didn't know how much inflammation I had in my body. And so I would say the very first one that a lot of people are not aware of is those, extra pounds that you're carrying on your body. It may not be fat. Oftentimes it's inflammation, especially if you've been sick and not feeling well. It's very, very likely that it's inflammation. Headaches can be another one. Your skin just not looking very good, not looking healthy, and your hair being dry. That can be another sign of inflammation. Brain fog can be a sign of inflammation. GI issues, gut issues can be a sign of inflammation. But then sometimes people are just not aware of their bodies. A lot of people are super disconnected with their physical body and they don't even notice that they're having symptoms, much less symptoms of inflammation.
Right. So inflammation is really a biomarker saying, hey, body, there's a problem here, something we need to deal with. And you're right. I think we overlook these symptoms that it's very easy to write off that, oh, maybe there's something else going on. I mean, I love that you use the example of weight gain. I mean, I can remember I had a patient in my clinic who over the course of 6 months lost over 50 pounds with just making dietary changes. She was getting so much inflammation in her gut from what she was eating, and once she made those diet changes, she didn't exercise anymore, she wasn't doing anything else different in her lifestyle, but it's all that water weight, that water retention that inflammation creates. And once she said, she was like, "Yeah, I'm peeing, like a racehorse, and I'm just peeing all that fluid off." I'm like, "Right," because now, the inflammation's going down, you're metabolically changing, and now you're able to finally, drop all that weight. But these subtle cues of inflammation get overlooked so often. I mean, as someone has a neurological disease, inflammation in the brain, Like you said, headaches, brain fog, it can be neuropathy, it can be balance problems, coordination issues, sleep disturbances, mood changes. It seems like there's just a million different symptoms associated with inflammation. So, I guess maybe the questions beg then, how do we necessarily know that we have inflammation? If you're not really tuned into your body, again, if we can't see like, the stub toe or the swollen elbow, how can we measure this? How can we figure out if that's part of what's going on internally?
One of the best indicators of whether or not you have inflammation is how do you feel? Do you have any type of symptom, any type of condition, any type of disease? Because if you do, chances are you have inflammation, like 99% chance. Because I think there's probably only maybe one or two diseases out there that are not caused from chronic inflammation, like, leading them right into a disease, a condition, or a symptom. So if you haven't been well, if you have any type of chronic symptom, condition, or disease, you pretty much it's a strong bet that you've got inflammation in your body.
So, do you have a differentiation between, acute inflammation, chronic inflammation, in terms of, when you're approaching a client, do you think of it in that ways, or is it just kind of like inflammation is inflammation, and at the end of the day, it's really all the same thing?
I think that there's a difference. In some cases, it depends on the context that we're talking about, right? So earlier, we started out the whole conversation about talking about how inflammation is a normal process and it's a healthy process, except for when it gets out of control. So, acute inflammation could be just part of a normal healing process. And it is a part of a normal healing process. If you stub your toe, you're going to have what's called acute inflammation. However, and that's a part of the healing process, and that's okay. It has to. Or if you cut your finger and then you put the band-aid on it and then you peel the band-aid off the next day and it's sore and it's a little red and swollen, that's inflammation. It's a part of your body's healing process. But there are times, so depending on the context, right? There are times when you can have acute inflammation that's not good for you. Because it's just it's adding to the chronic inflammation. So a good example would be you have some severe gut issues, whatever it is, whatever the diagnosis, whatever the condition, it doesn't even matter. But you've got some sort of severe chronic gut issue. That tells us right away, we don't even have to look at a test for that, that you've had chronic inflammation. It's been there a long time. However, you're probably doing things unknowingly every day that's causing acute inflammation. So, for example, you already have road rash inside the gut. It's already hot and gross and just like raw inside. It's all inflamed because it's been like that for years, because of the things that you've been eating, for example. Well, you go to the doctor gives you steroids or whatever to try to calm it, but you keep having that glass of milk before bed because you think that's healthy. I get my protein and my vitamin D and my calcium. I got to have that glass of milk before bed. Well, every time you have that at night, you're causing another fire. You're starting another fire on top of the embers that have been burning in your GI tract for years now. You're lighting a new fire every night when you put in that milk in your gut before bed. So that's an example of acute inflammation, but it stays chronic, like it stays there because you keep doing the milk every night before bed. So it never has the embers never have a chance to burn out.
Yeah, it's such a great point because I think, again, understanding that process of how we have these repeated insults, that come on and on. I think of it too, and even in cases of like allergies, if you're allergic to pollen, every time you breathe in a big, waft of pollen, your nose gets swollen, you can't breathe through your nose, you feel the congestion, you get the drippy postnasal drip, and it's just that repeated ongoing exposure. So I guess that kind of segues into, what are some of the things that you see as being some of the biggest triggers of inflammation? And I know that's probably a whole hour long conversation, but
Well, it's actually a 5-part series. So our Inflammation Masterclass, that is getting ready to launch, goes 5 days, day by day, taking the viewer and the listener on a really, really deep dive into the science behind all of the most common root causes of chronic inflammation that leads to all the diseases. And then we teach, and then we show case studies before and after with labs and symptom sheets on different clients that we've had from around the world, and what was causing their inflammation, and how we took them through the process of removing all the barriers to healing that was causing the inflammation in their diseases, symptoms, and conditions, and how they got better. And so, but boiling it down for you here, for the listener, there are, we have found through our testing, we've done thousands and thousands of labs all around the world, clients in 18 different countries. We have found that there are some common denominators when it comes to what are the root causes of inflammation, of all this, and all of these diseases, conditions, and symptoms associated with it. And that's food, environmental chemical toxins, heavy metal toxins, mold toxins. We call those mycotoxins. And then, of course, you've got EMS can do that as well. And then we have medications, believe it or not.
Right.
Medications are great for saving lives. Oh my God. It's amazing what we've been able to do in the pharmaceutical industry with literally saving a life. But medications, they don't cure anything. They're just covering up the symptom, allowing the issues to get worse. And a lot of medications actually cause more inflammation. A lot of people will say, well, leaky gut causes it, but I'm going back a step further than that, right? It's all of these toxins that I've just mentioned are causing leaky gut, which is spiraling into more inflammation. But then we've got the final ones. And this is something that a lot of people are not even aware of. Your thoughts, your emotions, and unprocessed emotions, unresolved trauma, and your thoughts and belief systems can also cause a cascade of chemical changes in your body, leading to chronic inflammation. And so those are the things that we find are the most common underlying causes.
Yeah, and I might add infection to that list as well. I see a
Yeah.
lot of people with, whether it's Lyme disease, Epstein-Barr activation, chronic strep. But again, I think that awareness that there are so many potential triggers. So, for those of you tuning in, you definitely want to work with hopefully you're working with a functional medicine naturopathic doctor that can help you sort out all these different root causes because there are so many. I always feel like, we're standing in the center of a wheel and there's all these spokes going out, which seem like different directions. But there's so many things we have to look at because there's so many possibilities of why, in this case, inflammation can be problematic. And if we just focus in on one thing and ignore all the rest, we're really missing the boat.
Yeah, absolutely. And thank you for mentioning that. I meant to mention that with the mycotoxins. So bugs that don't play well in our ecosystem. And you're absolutely right. I think that there are a lot of practitioners out there who are taught in a certain manner, and they become very laser focused. They're down in the weeds and they forget to come up out of the weeds and look at a broader view. And so, they're always looking for mold, or they're always looking just for infections, or, oh, everything is H. pylori. Oh, everything is candida, or everything is like Lyme or whatever. When the reality is that when people are chronically sick, at least this is what we've seen, Darren. I don't know if you've seen this too. When people are chronically sick, they have a combination of these underlying causes. And it's never just one thing, it's a combination of things. Usually, we've got three or more of all the underlying causes I mentioned. We usually have three or more of them going on.
Yeah, I mean, I can just say, like in my Lyme population, it's almost never just Lyme disease. It's Lyme and mycotoxins, Lyme and trauma, Lyme and something else. So you're right. If we're really practicing holistic, whole person care, we've got to look at all these different factors. And again, we're also very, individual and unique. And even though there might be 10 people that have the same factors, the degree into which each factor influence each person can also vary pretty widely. So really important that you're having this discussion with your healthcare provider so that you can really look into these different causes. So I know everyone's thinking now, it's like, okay, I've got this inflammatory process going on. I feel terrible. You know, I know that you talk about this in your master class, but can you share a little bit, maybe like your top three strategies of, how do we actually help reduce this inflammation?
So, reducing the inflammation itself, that's not hard. And we will touch on strategies, but I want to hit on something that I think is not talked about enough, and that is setting realistic expectations. We want instant results. And oftentimes, as consumers, we'll see things pop up on the internet, even from people who are very well respected, practitioners and doctors. And it'll be like, oh, try this, detox. It'll help reduce inflammation and da 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 da. But it's like a month long, or maybe it's a 90-day challenge at the most. We have done thousands of case studies, and we see that it takes an average of 9 months to get all of these barriers to healing out of the body. I'm talking like toxins. They
Right.
don't come out, and heavy metals can take longer. So, it takes time. And so I think that's the most important thing for the listeners to hear is like, look, there are a lot of detoxes out there and they do work, but people are not taking them long enough. When you do the testing and you follow the lab data, and like if you were to test every 3 months, every 4 months, you'll see, when you get your baseline testing, you'll see, oh, I've got these 7 chemicals in really high levels. I've got glyphosate, I've got triclosan, I've got, these different plastics. I've got 2,4-D in my body, which, believe it or not, that was used in, ancient Agent Orange back in Vietnam War. And it's illegal now, but why are we still finding it high levels in people's bodies? It's still being used out there. So you'll see all these toxins. You get your base level in there. I've got these molds, I've got these toxins, I've got these heavy metals, I've got these infections, I've got all this stuff. And then infections are probably, excluding Lyme, other infections are typically the easiest, like the fastest things, not the easiest, but the fastest things to get out of the body. But when you retest after 4 months, you almost always see that the levels appear to be higher. The levels of the toxins that are in your body. I'm not talking infections. I'm talking like mycotoxins. I'm talking about those chemical toxins, even heavy metals. You'll tend to see the levels look higher, and we want to see that. That means
Right.
that the detox is working. Stuff is not stuck to your tissues anymore. It's coming out in your urine. And so, yay, it's coming out. Then, when you retest again at month 8, you'll typically see, so another 4 months later, you'll typically see some of the toxins are already gone by then, and then there's a few that are still hanging on that you still need to finish, getting out. And then by month 12, you usually see everything is gone. And so having realistic expectations is good. There are a lot of different types of products with different ingredients that can be used for detoxification. But the key here is time. And then if you can follow it with some lab data so that you can see that what you're doing is working. And then you have to make sure that you stop exposing yourself because, you can take, you know, if you're taking a detox regimen and you retest yourself and then you retest yourself again and you're at the 8 month mark and you still see those persistent levels and they're not coming down or they've only come down this much, you're doing one of two things. There's only two reasons why that'll happen. One is you're not taking your stuff like you're supposed to every day, or two, you're still exposing yourself. You're still putting it in your body. You're still, like you're still living in a house full of mold. That's why no matter how much detox you take, you might see it come down this much. It's never going to go away because you're exposing yourself every day. Yeah. I mean, I think that's the most important thing. Now, as far as strategies that you can use, I think that the best strategy is if you can do it, if you can afford it, the best strategy is get some lab data. The data doesn't lie. The data is going to give you a starting point and show you where you're at so that you can then go, oh my God, this is why I'm sick. I've got these 5 toxins. I just looked online and studied them, and these toxins are all known to cause almost all these symptoms that I have and these conditions that I have. Oh, okay, so that's the first strategy. Figure out what is going on in your body. What do you have in your body that's a barrier to healing? What are the toxins in there? They're not allowing your body to heal. So discover first, right? Let's find it. And then the next strategy, the best thing that you could do is remove yourself from those, remove your exposure or reduce your exposure as much as possible. Those are the first strategies that I can tell you that are going to be the most important. And then after that, if you want to learn how to take, like what you can take that's natural that actually works, because there's no pharmaceutical that's going to work for this. Only natural stuff works, which I think is pretty cool. And because it's safe too, then, do your research or work with somebody who knows what they're doing and let them show you how to put a protocol regimen together that's going to work for you so that when you do follow up with your lab testing, you can get the expected results.
Yeah, can you talk a little bit about some of the tests? I mean, I know I have my favorites, but what are some of like the routine labs that you like to run with the people you work with on assessing, what's going on in their body?
Yeah. So, um, in our model, what it's changed so much. I mean, we have so many evolutions of how we practice. If you and I talked about it 10 years ago, we were doing this so different than what we're doing now. We're always improving as we see what works
Right.
and the new technology that comes out there. And, many years ago, I started everybody out with blood work. And most of my women, it was blood and hormones, right? Then I went into blood hormones and neurotransmitter testing because I love working with brain stuff, as you know. Like I once had big brain issues myself, and so brain is so huge. And so then I was doing, neurotransmitter. I was running that test on everybody along with their blood work and then their hormones. Then I got into the genetic test. So now I'm doing blood work, hormones, uh, um, neurotransmitter tests, and genetic testing on everybody. Getting pretty expensive. It's getting up there. Then I had this epiphany that I was like, wait a minute. Like the reason why these people are sick is because they have barriers to healing. You see, the body is intelligent. It knows how to heal itself, and it has systems already set up and backup systems for the backup systems to self-regulate and self-heal. When it can't get better, we have to sit back and ask ourselves, what is blocking our body's ability to heal? And so once I really started putting it all together in my head and having these epiphanies of, well, we've got all these toxins out there, then I discovered that you could actually test for the toxins. And so then I added those to all the other labs. Well, fast forward, we've had many iterations of how we do things. The first labs that we run on people are the toxin labs before we do anything else. We already know that their blood is going to show that it's off here and that they have inflammation and we still do run blood on people, but it's not a requirement in the beginning. I don't run hormones first thing. I barely ever run neurotransmitters anymore. We look at their symptom sheets and their history and we look at their assessment forms, but we start out with what I like to call uh, my tox bundle. So we're looking at environmental chemical toxins. We're looking at heavy metals. We're looking at all the different moles toxins. And then we're doing an organic acid test, which can give us a clue as to different bacterial types of infections and things like that. So we do that as our first test, as our first, if you're going to come work with us, that's where we're going to start. Will we do anything else in the beginning? That depends, right? Do you want to do it? Does your history and do your symptoms indicate that we should probably do some extra labs? Then we can do that too. But the tox bundle is where we start, Darren.
That's great. Well, it's such an important facet because, again, there's so much we're exposed to that we might be unaware of. Again, I run these same panels, and I'm not surprised anymore because I've run so many of them, and you aren't either. But people are surprised and they go, "Oh my gosh, I had no idea I had high levels of flame retardant in my blood or my urine." I'm like, "Right, because that new mattress you bought and been sleeping on for the last 2 years is filled with flame retardant." Or they'll come back with MTBE, some sort of petrochemical byproduct. I've worked with patients in Texas, and they live out near the oil fields, and they get that exposure even though they're not aware of it. And like you said, the data doesn't lie. It gives us those clues to what you've been exposed to and potentially what's adding to your biological load. And that also gives us treatment strategies that we can employ that are actually going to help lower that body burden, and ultimately that makes your tissues and cells function better. So get the data. You're right. It's expensive, but I'm at a point, and I think you are too, that we hate throwing pills at people and see what sticks. We want to know whatever we're treating has a purpose, and that we've got, of course, the way you feel is incredibly important, but having these objective biomarkers that tell us that what we're doing is actually working is incredibly helpful.
Oh, absolutely. I mean, you know, you can easily say that, if you don't have the right information, I mean, you might as well put a blindfold on and throw the dart at the wall and hope that you could even hit the target, right? I mean, you're just trying things and you have to keep trying things and hopefully you hit the nail on the head right in the beginning. But a lot of people, that's where they end up wasting, unfortunately, losing a lot of their money and their time. is because they're trying to do things on their own, thinking that they're going to save money. Well, I'm going to save money. I can't afford these tests. So I'm just going to try this and I'm going to try that. Well, not only have you lost time because a year, 2 years, 3 years, 5 years later, you're still sick. So, but you've also lost a lot of money because you've tried 10 different things that didn't work, hoping that it would. You end up saving a lot of time and a lot of money if you just, you know, see the value and do whatever you need to do to collect that data so that you know from the beginning exactly what type of plan of action that you need to get yourself better again.
I could not agree more. Well, if you guys are tuning in and you're interested, Dr. Lena's again got a great 5-part masterclass where she walks you through all the aspects of inflammation, understanding core root causes, and then talking about different treatment strategies. So again, we'll drop the link to the masterclass. So Dr. Lena, again, thank you so much for joining me. This has been really great conversation.
Thank you so much, Jared. It's always a pleasure getting to chat with you.